Here are 8 skin signs of diabetes you shouldn't ignore. The skin is the largest organ of the human body. It's packed with nerves and blood vessels that allow us to feel touch, sense temperature, experience pain, and detect pressure. In this video, we're diving into 8 important skin signs your body may be using to alert you about diabetes. From unusual dark patches of skin to wounds that take too long to heal, these are things you don't want to overlook. Stick around until the end of the video because I'll share a tip that can help you spot these signs earlier, allowing you to prevent or manage diabetes more effectively. Ready? Let's get started. Number 1, yellowish, reddish, or brown patches on the skin, the body maps. These patches may appear on the legs, hands, or arms and are often a result of a condition called necrobiosis lipoidica diabeticorum, NLD. Although rare, affecting only 1 to 4% of people with diabetes, it's a hallmark sign strongly linked to the disease. These patches are typically thin, shiny, and well-defined, and they may sometimes feel slightly painful or itchy. In the diabetes community, they're humorously referred to as diabetes passports because their presence is often a clear indicator to doctors that prolonged blood sugar imbalance is at play. NLD serves as a reminder that high blood sugar levels are damaging the small blood vessels beneath the skin, causing inflammation in the fat and collagen layers, which leads to these changes in skin color. In a health seminar survey in Texas, 70% of participants noticed such skin changes but dismissed them as simple bruises or ordinary skin damage. Unfortunately, many of them were later diagnosed with type 2 diabetes. One persistent characteristic of NLD is that these patches rarely go away without proper blood sugar management. On the contrary, if blood sugar remains uncontrolled, they can develop into slow-healing ulcers, increasing the risk of infection or even necrosis. Moreover, recent studies indicate that people with these patches often face a higher risk of complications, including cardiovascular and kidney diseases. This means these patches aren't just marks of diabetes but could be a ticket to more serious health problems if ignored. Number 2, unusually darkened skin, the secret mirror. This condition, commonly known as acanthosis nigricans, AN, is not rare but highly distinctive. It's a telltale sign of insulin resistance, a critical warning linked to diabetes. And is characterized by darkened, thickened patches of skin that feel velvety to the touch. According to data from the American Diabetes Association, over 90% of people with acanthosis nigricans are either diabetic or at high risk of developing type 2 diabetes. These patches typically appear in areas with folds or creases, such as the neck, armpits, groin, and sometimes around the knees or fingers. Here's an interesting community story. In a study conducted in American high schools, during routine health screenings, school health professionals discovered that more than 30% of students showed signs of AN, and many of them were overweight or had a family history of diabetes. Early detection helped these students make lifestyle changes to prevent the disease. Many people mistake these dark patches for the result of poor exfoliation or prolonged sun exposure. However, AN doesn't cause pain or itching, which makes it easy to overlook. In addition to diabetes, AN can also be associated with polycystic ovary syndrome, PCOS, or other endocrine disorders, further underscoring its significance. Doctors emphasize that with proper blood sugar control and maintaining a healthy weight, these dark patches can fade over time. This highlights the importance of addressing the root cause rather than dismissing AN as a mere cosmetic concern. Number 3, thick and stiff skin, the invisible armor. If you notice the skin on the back of your hands becoming thick, waxy, and tight, along with difficulty moving your fingers, it may be more than just a minor issue. This condition, known as scleroderma diabeticorum, is a classic warning sign of prolonged type 2 diabetes. Notably, this condition isn't confined to the hands. It can gradually spread to the forearms, upper arms, and, in severe cases, affect the back, shoulders, neck, chest, elbows, and even knees. A study published in Diabetes Care found that 20% of long-term diabetes patients develop this thickened skin condition. For those affected, the skin not only becomes thick but also loses elasticity, interfering with daily activities. One study participant shared how he could no longer fit into his old shirt because the stiffened skin on his shoulders and arms limited his range of motion. When this condition progresses to the knees or ankles, it can cause difficulty straightening the legs or bending the knees, making walking a challenge. The underlying cause of this phenomenon is fibrosis of the tissue beneath the skin, triggered by high blood sugar levels. Uncontrolled blood sugar damages small blood vessels, leading to glycation of collagen fibers. This process stiffens the collagen, reducing its flexibility, which explains why the skin thickens and mobility becomes restricted. At a medical center in Michigan, doctors documented cases where many patients initially dismissed early signs of scleroderma as mere dry skin or the result of heavy physical labor. However, when the stiffness spread to the neck and back, some patients found themselves unable to bend their heads or turn their necks naturally. For some, it took up to 6 months of therapy and strict blood sugar management to achieve noticeable improvement. This underscores the importance of recognizing and addressing early signs of this condition to prevent further complications. Number 4. Dry and itchy skin, the warning signal. When your skin becomes persistently dry, tight, and itchy, especially on areas like the lower legs, hands, and elbows, it may be more than just a reaction to weather changes or lack of moisturizer. According to the American Diabetes Association, this condition often stems from dehydration caused by high blood sugar levels, which depletes the skin's natural moisture and makes it more vulnerable to damage. What's unique here is that it's not just about dehydration. The process of glycation, where excess sugar binds to proteins, directly affects the skin's structure. Glycation breaks down collagen and elastin, two key components that keep the skin elastic and soft. As a result, the skin becomes rough, cracked, and slower to heal from injuries. Persistent itching can also be linked to toxin buildup in the blood. When kidney and liver functions are impaired due to diabetes, waste products like urea accumulate, leading to a condition called uremic pruritus, a severe form of itching, particularly in areas with fewer oil glands. In one study, researchers found that prolonged high blood sugar levels reduced skin hydration by over 40% compared to healthy individuals. This imbalance makes the skin more prone to cracking, and these cracks create an ideal entry point for bacteria. Moreover, harsh environments, like cold and dry winters, can significantly worsen dryness and itching. Experts noted that people with diabetes living in tropical climates experience 30% fewer cases of itchy skin compared to those in colder regions. This highlights the importance of living environment and skin care routines in managing these symptoms. Addressing these signs early through proper hydration, skin care, and blood sugar control can go a long way in preventing complications. Number 5. Blisters that resemble water bubbles, a hidden alarm. This condition, known as bullosis diabeticorum or diabetic blisters, is a rare but noteworthy complication in people with long-standing or poorly controlled diabetes. These blisters often appear on the fingers, feet, forearms, or lower legs and range in size from a few millimeters to several centimeters. What's unusual is that they typically form without any direct cause, like trauma or friction, leading many to mistake them for common skin conditions or dismiss them entirely because they're usually painless. The formation of these blisters is linked to the weakening of skin layers due to high blood sugar levels, which reduce the skin's ability to repair itself and make it thinner. Researchers often liken diabetic skin to an overinflated balloon. Even minimal pressure can cause the surface to blister. In an experiment at the University of Miami, scientists simulated high blood sugar levels in a lab setting and observed that skin pressure increased by 40% compared to normal conditions, significantly raising the risk of blister formation without noticeable external force. While these blisters might seem harmless, they're far from it. Once ruptured, they become entry points for bacteria, leading to serious infections, especially on the feet, where circulation is already compromised. In countries like the US, where diabetic foot complications are a leading cause of hospitalizations, these blisters are seen as an early warning sign that requires close monitoring. Addressing them promptly can help prevent more severe outcomes like infections, ulcers, or even amputations. Number 6. Spots and dents, the mysterious marks. If you notice small spots or unusual dents on your skin, particularly around your legs, it might be a sign of necrobiosis lipoidica, a distinctive skin complication in people with diabetes. This condition typically begins as small spots in shades of yellow, red, or brown, which gradually develop into indented areas with a thin, shiny surface. According to a study published in the Journal of Dermatology, only about 0.3% of diabetes patients develop necrobiosis lipoidica, though it is more common in those with type 1 diabetes. These spots and dents often appear on the lower legs, near the shin bone, and can range in size from a few millimeters to several centimeters. The hallmark of this condition is damage to the small blood vessels beneath the skin caused by prolonged high blood sugar levels. This leads to chronic inflammation and the destruction of connective tissues. Another study found that blood circulation in affected areas decreases by 20 to 30%, slowing skin regeneration and making these areas more prone to injury. The surface of these indented areas is often so thin that blood vessels beneath the skin become visible, leaving these spots vulnerable to ulceration if subjected to trauma or infection. In one reported case in New York, a retail worker noticed small spots on her legs that gradually grew larger due to prolonged periods of standing. Over time, these spots developed into skin ulcers, complicating treatment as her immune system was weakened. Recognizing these signs early and seeking medical advice can help prevent further complications like ulcers or infections, which can be challenging to treat in diabetic patients. Number 7. Yellowish plaques around the eyelids, a subtle signal. This condition, called xanthelasma, occurs when cholesterol builds up beneath the skin, appearing as flat or slightly raised patches with a pale yellow hue. These patches are soft and well-defined. A study from Harvard Medical School found that about 50% of individuals with xanthelasma are diagnosed with diabetes or lipid disorders. These yellowish plaques often develop symmetrically on both eyelids and can range in size from a few millimeters to several centimeters if not managed promptly. While xanthelasma might seem like just a cosmetic issue, experts often refer to it as a window to vascular health. The yellow deposits signal that excess cholesterol is not only accumulating on the skin but also potentially clogging blood vessels, increasing the risk of atherosclerosis. A study in Norway reported that individuals with xanthelasma faced a 17% higher risk of cardiovascular disease within 10 years compared to those without this sign. Similarly, research in Europe found the prevalence of xanthelasma was twice as high among individuals who consumed diets rich in saturated fats. This trend was particularly noted in countries like France and Germany, where butter, cheese, and red meat are dietary staples. Moreover, xanthelasma is painless and does not itch, causing many people to overlook its significance. However, early detection can lead to preventive measures. Adjusting one's diet to reduce unhealthy fat intake, increasing vegetable consumption, and maintaining blood sugar levels can help prevent the patches from growing further. Recognizing xanthelasma as more than a skin issue can be a critical step in addressing underlying health risks and promoting overall cardiovascular well-being. Number 8. Skin tags, the silent clingers. Skin tags are small, soft pieces of skin that protrude and are attached to the body by a thin stalk. They typically appear on areas prone to friction, such as the neck, armpits, eyelids, or under the breasts. Although skin tags may seem harmless at first, they can serve as an important warning sign for individuals with diabetes. Research indicates that people with type 2 diabetes are 48% more likely to develop skin tags compared to those without the condition. The root cause lies in increased insulin resistance, a state where the body struggles to process sugar effectively, which stimulates abnormal skin cell growth. Skin tags are also associated with metabolic syndrome, which includes obesity, high blood pressure, and elevated cholesterol levels. According to a study from Stanford University, more than 75% of patients with over 30 skin tags were diagnosed with at least one of these factors, significantly increasing their risk of heart disease and diabetes. A clinical trial in the UK revealed that skin tags tend to appear more frequently in individuals with higher BMI and abnormal growth hormone levels, especially around the neck and armpits. Scientists have referred to skin tags as a readily visible biomarker, aiding doctors in quickly identifying potential metabolic health risks. Unlike other skin conditions, skin tags typically do not cause pain or itching. However, if subjected to frequent friction, they can become red, irritated, or even infected, leading to discomfort. A study in Japan highlighted that skin tags around the eyelids had a higher correlation with hyperglycemia than those in other areas, underscoring their significance as a signal that warrants attention. Recognizing skin tags as more than a cosmetic issue could prompt timely interventions to manage underlying conditions and improve overall health. Early detection tips: recognizing signs for effective diabetes management. How can you identify these signs before they become serious? Here are some key tips to help you understand and care for your skin effectively. First, take time to thoroughly observe areas of the skin prone to friction, such as the neck, armpits, eyelids, and lower legs. These are common spots for signs like skin tags, yellow patches, or darkened skin. Pay attention to small changes, such as an unusual dark spot, blisters, or gradually appearing indentations. If your skin becomes persistently dry, tight, or itchy, don't just blame the weather. It might be your body's way of warning you about unstable blood sugar levels. Second, use natural light or bright lamps to carefully inspect your skin's surface. A study at Harvard University revealed that over 40% of people with diabetes fail to recognize skin-related symptoms because they often appear in hard-to-see areas or are covered by clothing. Consider asking a family member to help check places like your back or the backs of your legs. Another key tip is to pay attention to unusual sensations. If you experience unexplained itching, sudden small blisters, or find certain areas of your skin becoming softer or harder, don't ignore it. These are some of the body's first warning signals when high blood sugar levels begin to damage the skin and small blood vessels. In addition to observation, make skincare a routine. Regularly moisturize, especially after bathing, to maintain elasticity and protect your skin from minor injuries. Avoid taking overly hot showers, as they can strip your skin of its natural moisture. Finally, don't skip regular health checkups. Blood sugar levels, lipid profiles, and kidney function are all critical factors connected to skin symptoms. Early detection and timely intervention can help you manage diabetes more effectively, while also protecting your skin and overall health.